Gauteng MEC for Health, Nomantu Nkomo-Ralehoko, has now joined us for a conversation to expand as Gauteng plans to expedite the enhancement of healthcare services by identifying and assessing suitable land for the construction of 4 additional hospitals in the province. MEC, a very good evening to you. Thank you so much for your time. With 4 new hospitals in the pipeline for an ever-growing population, what gaps are you aiming to close with this project?
We are going to be, let me greet first yourself and the viewers at home. My apology. No, indeed, we need to close the gap of our infrastructure because we have a number of people now that were admitting in our hospitals. Although we're trying to do local health promotion programs that are insisting on prevention, but it doesn't help because of the high number of people that come to our facilities. Hence, we are going to have 4 hospitals that are going to be built, and you have heard Premier when he was indicating that. But besides that, we are refurbishing some of our hospitals and our clinics. And in some of the hospitals, we have added some wards that we are doing that are going to help us to ease up the pressure that we're having, especially in areas where we don't have acute mental health wards. So that's what we have been doing so far. Premier indicated that we need to start those hospitals. One of the areas that we are going to do in terms of the infrastructure hospitals that needs to be built is around Soshanguve area. The other one is around Davidton. That one already systems are in place. Processes are just going to start soon in Davidton. Orange Farm and Dupslot. All the 4 business plans are there, but the Davidton will be the first one to start to go soon as possible. Whilst and then we look for the additional facilities around the province.
And what is the rationale behind the spots that you've identified?
The rationale is that you remember some of the patients that are coming from, that you find in Tembisa, they are coming from Davidton, some are coming from Dipslot, some are coming from Olive and Houtbush. I'm sure you have seen the overflow that we always talk about in Tembisa. So those people are going to Tembisa, most of them. And I have been there, I've been checking them. Even when you count 1, 2, the third person will say, I'm coming from this specific area, not even coming from Tembisa. Then again, around Gauteng, Johannesburg, we have the other institutions. We don't have most district and regional hospitals, and most people go to Chris Hani Baragwanath Hospital, so we're easing up the pressure there. But we have again the Lenasia Community Health Center that now we've converted it into a hospital, so that some of the patients can go to Lenasia, just ease up that pressure in that corner. We have a high number of areas now that have been built in the province. Hence, there is this huge number of influx in our hospitals.
I'm glad you mentioned Tembisa because Tembisa's hospital staffing crisis has reached a breaking point. It's all very well, MEC, I'm sure you'll agree with me, to build these hospitals, but what will change? More so, as, I described Tembisa on one end, but we recall how just a month ago, we were again reminded of some of the harsh realities of the South African public healthcare system when broadcaster Tom London documented his horrific experience at the Helen Joseph Hospital. In the videos, he spoke about the challenges he faced, the lack of care, distressing conditions, and the negligence he witnessed firsthand. His words, of course, struck a chord with many South Africans who have experienced similar struggles, or some who know people who have. Are you not about to create another round of a perhaps vicious circle where you're trying to provide a service, but, there's many downfalls and many challenges that come with it?
I don't think we will, because what we have done, even in the other hospitals and in the whole province, remember there are campaigns that we have launched, and one of those is hashtag Serve with a Smile campaign. That campaign is just dealing with the staff attitude of our employees in our hospitals, starting from the security guard, from your cleaner, from your administrator, your nurse, and your doctor. So those are the things, the interventions that we need to do just to improve in that specific area. But we need to improve our infrastructure, because today I was with a committee from from National Assembly, we visited some of the hospitals. One of those is O.R. Tambo Memorial Hospital. That was built in 1905. You can see that the infrastructure is old, and we are renovating some of the areas at O.R. Tambo, but we are building some of the specific wards where we can see that this one we can't keep it. So there are those specific areas that there is a need for us to definitely improve our infrastructure. Even the other hospitals that you can say, most of them are old. They have not been built now. Some have more than 50 years, like your Yusuf Tadu Hospital. It's one of our oldest hospitals too, including Helen Joseph too. But that's why we are renovating part of the areas in Helen Joseph. And pity that there was that incident that happened. Some of these things don't need major improvements, refurbishment, just re-enameling the bath, if it's the bathroom or the ablution block in that specific area, it helps. So we've got quite a number of improvements that we want to do just to change and facelift even the hospital. That's another area that we are going to do. All the hospitals are going to facelift them so that when you get in, at least just inside that yard, you see that you're in the yard of a hospital. In fact, today I was very much impressed when I went Tele Mwerane Hospital, because just the facelifting that is being done at the front now there, it shows that the hospital is lookable. It's a place that you can go, and it services a lot of people, because quite a number of huge townships and informal settlements are going to that hospital. So that's another
MEC,
problem that
if you'll allow me,
facing
please, to interrupt you for the sake of time. Pardon me. You made mention, I want us to go back to the issue of Tembisa again, but you speak about a program, Serve with a Smile. But tell me, MEC, how do you serve with a smile when, if we look at Tembisa specifically, there are critical positions, 36 professional nurses, 6 staff nurses, 14 medical officers, and 11 cleaners. Those are the shortages that we're talking about. South Africa faces a critical shortage of nurses exacerbated by the aging workforce. I know you speak about a facelift on one end, but how effective will your programs be if vacancies can't be filled?
You know, you are right when you say that some of the aging workforce that we have, because most of these cases now that we have is a resignation that we have received in our hospitals because people are going on pension. But the other thing, there was a time that training of nurses was stopped. Now it's coming up now again, the training. We're starting to do those training. So it has created a gap to the system, that issue of not training. That's why now we're reskilling our workforce and we're skilling some of them, because even the training that has been done recently, they were saying you are not trained to be an all-rounder in a hospital. There are specific areas that you have not done in that training. So that's why then the issue of reskilling is being done. But again, we're trying to make the Department of Health an employer of choice. We have some programs that we're doing now of trying to improve the levels of employment, make them feel happy, even if they still have staff shortage, because staff shortage, you can go to each and every hospital. We still need nurses, we need doctors, we need cleaners, we need porters, because that's what I was saying even to the committee today, that we are looking into the whole value chain. In the hospital, you not only employ a doctor, that doctor can't be an administrator, that doctor needs a porter to bring the patient, that patient must be, somebody must register the patient at the reception. So this is what we are looking into, that cycle now. And I already have submitted the structure to the Premier, the new structure. Remember, we've been operating in an old structure. That's why the capacity must be beefed up now in the hospitals. Premier has approved the structure. But again, what he has done, because all these posts, we must check if there are funds based on the post. Already the ones that you're talking about, they are funded. We will be employing a number of workers now once Premier approved that, because we have to provide a proof that I need these 50 nurses, but out of the 50, this is the amount that has been budgeted for. But it's not only the nurses, it will be the cleaners, it will be the other people, porters, that must work with them. So in all those specific areas, we've done a business case, we've submitted it. Some of them, the interviews have been done already, because the systems have been moving, but we still need more. That's why I'm saying I agree with you. But again, they must serve with a smile. We must support them to make sure that they feel that Department of Health is an employer of choice. In fact, I always say not just choice, it must be the employer of first choice. So there are those programs that we've created every month that will do with them, including, besides this hashtag Asibe Healthy GP. Tomorrow we're launching Corner to Corner. That's another way of corner to corner in the township, going with them, doing some exercises, working with those communities, but at the same time, encouraging the staff for counseling if they need be there. There are certain programs that are designed for them, whilst there are other programs.
Thank you so much, MEC. We're out of time, but I'm glad you mentioned support, because today the world marks World Mental Health Day, and the work environment is something that's under scrutiny as we take stock of it. Gauteng MEC for Health, Nomantu Nkomo-Ralehoko, joining us and expanding on some of the plans around Gauteng.